Hello, this is Dr. Michael Rothman, and in this video I want to talk to you about sarcoidosis. If you've been diagnosed with sarcoidosis, this is a very scary diagnosis because sarcoidosis can literally affect every organ in your body. If you go to your regular doctors and you've been diagnosed with sarcoidosis, they'll invariably put you on prednisone or some other immune system suppressing drug in an attempt to reduce the inflammation. But let me share with you my clinical experience. Every patient that I've ever seen with sarcoidosis has low levels of cortisol when you test their blood in the morning. Cortisol is a vital hormone for inflammation. It acts as an anti-inflammatory hormone. And if your cortisol levels are dropping, you can have all sorts of inflammation in your body. Well, you may ask, well, doc, what's causing my cortisol to drop in the first place? And the answer is stress. If you've had too much stress over a prolonged period of time, your adrenal glands will get tired, so to speak, and you won't make the cortisol. You also need to feed your adrenal glands the proper material for them to make the cortisol, and believe it or not, cholesterol is vitally important for your overall health and your adrenal health. Another thing that I find in every single sarcoidosis patient is a pattern in their complete blood count. We'll see elevated levels of monocytes, also known as macrophages. These are very highly active immune cells. And the macrophages will have an effect on the vitamin D levels. When you test these patients, very often their vitamin D level, their 25-hydroxy vitamin D, is low. But if you test something called calcitriol, also known as 1,25-dihydroxy vitamin D, you'll find that despite the regular vitamin D being low, the calcitriol levels are elevated. Now, why is this important? Well, the macrophages actually cause this production of active vitamin D from the inactive precursor. And if you have too much vitamin D in the tissue, in the form of calcitriol, it will actually cause calcium to deposit in the tissues. Well, guess what? Sarcoidosis manifests as excessive calcium deposition in lungs and other tissues. And it is well known that sarcoidosis is associated with activated macrophages and increased levels of calcitriol. This is all in the medical literature or the scientific literature, but this is very poorly known in the mainstream. Then the next question becomes, what is causing the macrophages to be activated in the first place? There's something in your environment that is causing an immune system response, which is causing an unremitting stress on your system, weakening your adrenal glands over time, creating this active form of vitamin D, which is then laying down calcium deposits within your tissues. And believe it or not, one of the most common things that I have found, which is underlying all of this, is exposure to mold. Mold will activate your macrophages and set off this entire reaction. So what should you do if you have sarcoidosis, if you've been diagnosed with it? You need to see a doctor who understands human physiology and understands how all these processes work. If you merely take drugs to treat your symptoms, eventually the inflammation that's causing your sarcoidosis will lead to other diseases, other symptoms as well. So it's vitally important to figure out what is causing this problem and treat it, and you'll be so much better. In my patients that have sarcoidosis, I will make sure that they're on a good diet, avoiding sugar completely, avoiding fried foods and vegetable oils, eating plenty of foods that contain saturated fat and cholesterol, including things like eggs and cheese and meat. However, don't fry or burn the meat because then you will oxidize the cholesterol, and this is not helpful. This will actually make things worse. So proper diet is vital. If you're being exposed to mold, you must find out the case. And there are tests that can be done. There's genetic testing. to see if you are genetically predisposed. You can test your home. You can test for antibodies. There are various tests. You can test for mycotoxins in your urine. There are many tests to do this. But you need to find the cause of your problem, and it can be fixed. I've had great success treating patients with sarcoidosis. I hope this is helpful. Have a great day. Thanks for watching.